When preparing a patient for an EKG, why is it essential to ensure proper anatomical electrode placement? And what this is referring to is, let's say that this is your patient and you're starting the EKG. When you put the electrodes on them, so you have your stickers and then they go on the chest, and then you have your leads that they connect to go to the EKG and then measure the heart rhythm. What the question is asking for here is how come we put the electrodes on in a specific order as opposed to just putting them on wherever we feel looks like a good spot for it to go. So the main things we want to keep in mind for this question that really goes with most of our questions that we have as a medical assistant is safety and accuracy. That's the overall theme for our questions on this exam. We want to keep our patients safe and we want to have accurate results. So let's keep those two things in mind when we go through the question choices. So option A says to ensure patient comfort, and that's something that maybe we'll consider, because if we think of comfort, that has to do with safety, accuracy. So, all right, let's leave it open, and let's go through the rest of the choices and then come back to compare them. Option B says to make the electrodes look organized, and usually when anything has to do with look or appearance, when you're doing a patient exam, that's usually not the right answer. There's usually another reason that'll come back to here, safety and accuracy. So we can eliminate option B. Option C says to reduce the time in the procedure, and actually putting the electrodes on in the correct order actually could take a lot of time because you're looking at the numbers, you're making sure it lines up to where it needs to go, so it's definitely not done to reduce the amount of time in the procedure. It's done for another reason. And that reason of why we do it is to get an accurate reading. So really, option G is a better choice than option A. We are doing this for our accuracy because if we don't have the electrodes in the right spot, then it won't be picking up the heart rhythm correctly the way that it should. And then going back to option A, because we did leave this open, the patient comfort really shouldn't change based on where the electrodes are, because for the EKG, they are like the sticky parts. So whether it's put higher on the chest, lower in the chest, it really will feel the same for the patient. We just want to make sure that they're in the right order so we get the correct reading. So we will go with option D for this question.